This is going to be a 3-part series, but I'm hoping you will join us for all of them because I think that they will be very useful. How CLAS came into being, why it came into being, and then we're going to be exploring how we can actually put it to practice. So my name is Suganya Sakalingam, and I've been working with the CLAS standards for a very, very long time. In fact, from its conception and inception, when I was working in public health.
Thank you so much, Suganya. I'm Scott Van Loo, and welcome everyone. My background is in pre-K through 16 education, with most of my experience in elementary schools as a special education teacher and assistant principal.
Hi, everyone. My name is Yasmina Luxinger. I am the Cross Systems Partnership team lead for the National Training and Technical Assistance Center for Child, Youth, and Family Mental Health.
Today, we are going to be talking about what the CLAS standards are and how they came into being, and to consider how they might help us in the school environment. The second session is going to be a much deeper dive into the CLAS standards, where we've taken the CLAS standards, which were primarily created for primary care and preventive health, and we have adapted it for the educational environment. And so we will explore what that adaptation is like and how school programs can adapt it. And the third one is how do we implement and sustain the CLAS standards in our organizations? For those of you who are not in schools, the general CLAS standards that we will be offering to you would still apply. So today, what we're going to do is we're going to talk about what the CLAS standards are, where they came from, what social determinants of health and education might need to be considered to ensure that through CLAS that we're creating equitable outcomes in our school programs, and then an introduction to the principal CLAS standard. And the principal CLAS standard is an overarching standard that really then within which you have 14 other standards. And we'll be talking about those standards next week. But today we wanted to share with you that overarching concept so that you can begin to think about ways in which you can already make the kinds of shifts and transformations that you are interested in doing. Many of you have probably also seen this, because I think lately in the last year, there have been many, many more webinars and sessions, workshop sessions and documents around equity. And this is a great illustration because it allows us to see how we think about equity. Because very often what people do is they think of equity and equality as being the same. Equality means everyone gets the same thing, no matter what their needs are. And so oftentimes the way we practice services in the US is that we say, we want to be fair to everyone. We want to be equal to everyone. So we want to give everyone the same services. And yet, unfortunately, as you can see with the young gentleman who is wearing that purple t-shirt, those services don't ever meet his needs. Whereas if you think about equity, it allows us to provide the resources and the services that an individual needs, that then allows them to be able to use the services, utilize the services in the way that is most meaningful for them, and to really be able to then address the outcomes that they are looking for. Sadly enough, reality sometimes looks exactly like the way you see on the left hand. Some people, some communities have many, many more resources than others. And one of the things that we have learned in the last 2-3 years of COVID-19 is this really came to the surface. It became very visible. And I think it will be hard for us to not think about this and to forget its existence. So we do have to do something about it, which really takes us to conversations around social justice, because social justice allows us to really look at all the things that impact us in our communities. And so one of the things we want to do is explore the class standards, because we help us do that, because it advances health equity, it helps to eliminate disparities, and it improves quality of care. So I'm going to turn it over to, I think, Scott, and he
Yeah.
will talk us through the origins of the class standards.
Can I jump in real quick before I hand it to Scott? The only thing that I wanted to jump in and say, as with my educator hat on, is the good news for educators, if you're joining us from the field of, from the role of an education professional, and I know a lot of us are, is we're familiar with a lot of the concepts and ideas that are presented within class standards. So you're going to be familiar with a lot of the language we use and a lot of the ways we talk about equity. What is going to be different, and the work that we have to do is to bridge the healthcare system with our education system. So we've typically not operated under the same roof, and we're not even regulated into the same areas of the law. But when we come together to have common language and terminology to talk about these things, we can have similar goals. So the class standards in this context will help school mental health professionals move towards common language and have a roadmap for cross-systems collaboration. And we'll be able to weave our worlds together a little bit more fluently. Circle back to what Suganya shared about the way that the class standards are structured. I like to describe it as a cupcake. We're going to today focus a lot on the principal standard, which is what the overall goal is. It's your completed cupcake. It's what everybody sees. There are 14 other standards that can be grouped into 3 categories. Some of them you might not see, like governance, leadership, and workforce development, or accountability and continuous improvement, but they're the foundation of the standards, even if sometimes you only see the frosting, which are the communication and language assistance standards. So I like to keep the image of a cake in my mind as we start to unpack these. And now I'm going to pass it to Scott, now that we're all clicked and caught up, to tell us about the history of the class standards and where they came from.
It's hard to imagine, but we're coming up on almost the 60th anniversary of the Civil Rights Act of 1964. And this was such landmark legislation and clearly very solid. Many laws were and regulations have been based on this passing of this act. And it took many years to get the legislation interpreted and into written form. So this slide here lists several other acts or interpretations from both the health side, the healthcare side on the left, and the education side on the right. So you can see throughout the timeline here, there's been many different interpretations of which guarantee the rights of both students and families to not be discriminated against, and language is included in that act of non-discrimination. So starting on the left, you have the Americans with Disabilities Act, which was landmark legislation around special education, the creation of IEPs and testing, standardized testing that would go into effect in determining disability, and that language at that time. And then, of course, these have all been updated, and new regulations exist as well. So the language now states that we must communicate with parents and families in their language, in the language that they can understand, and that they get all the information as well as testing. And then you can just see the other acts there too. We're not going to go into these in a lot of depth, but the Affordable Care Act in 2010 helped to again add some different regulation and some different language around non-discrimination acts and the inclusion of translators, translations on both sides here. And then most recently in 2015, both the Department of Justice and the U.S. Department of Education created documents and language that updated the Every Student Succeeds Act, which also has that language. So point being that all of the, I was looking quickly at the chat space, and thank you for those of you who introduced yourself and put where you're from and where you're working at. But all of us have regulations which guide the contents and the content of the class standards. So the good news is, and you'll find out, you're already doing a lot of the activities and actions that we would say are best practices within class. And we'll go over again how these two worlds kind of come together. And then these regulations hold that space for us.
The way I think about it is that culture at its most basic definition is a powerful social system based on a group's values, norms, and expectations. It's a communication and interaction guide for a group's way of thinking, feeling, and acting. Culture informs how a group perceives health, wellness, disease, healthcare, and prevention. And so when we think about culture from that perspective, it's clear to understand why culture should be a part of how we provide services. Many of you have probably also seen the iceberg. The iceberg is often used to denote what is both in our awareness and what is not in our awareness or consciousness. 1/10 of an iceberg is above water, 9/10 of it is below water. We also are providing a coral reef with the atoll on the top and the reef at the bottom, because it's the same analogy of a small part of the atoll is above the water and the rest of it is below the water. These are both ways in which we can reflect on how we need to understand culture and how we are often sort of get into the trap of only looking at what is on the surface, and we don't go beneath that to understand things more deeply so that our services can be suitable and resonant and appropriate for the people we serve. I mean, case in point, how do we define mental health? It's defined differently in very many cultures. We see it in the Western world as mental disorders. So if you are not within this norm, then you are in some way you are disordered. But there are cultures in which the norm is not just a small portion of it. It really also takes into consideration people who are on both ends of the spectrum, so that someone who goes into a trance is not considered as abnormal, that it is part of who they are. It is just the context and the situation that changes. And so really understanding the beneath the surface is critical. So the principal standard, as it was developed by the Office of Minority Health within the Department of Health and Human Services, was that to provide effective, equitable, understandable, and respectful quality care and services that are responsive to diverse cultural health beliefs and practices, preferred languages, health literacy, and other communication needs. So that is what is in the original class standards. As we began working with Project Aware and Healthy Transitions, and now working with school mental health, we recognize the need for making an adaptation to that standard. And so what we are offering from an educational perspective is to ensure that students, parents receive from all staff members effective, understandable, and respectful mental health care that is provided in a manner compatible with their cultural health beliefs and practices and preferred language. very similar, but it takes into account that the clientele is our students and our parents, and that the people providing services, the staff, that can include teachers, it can include school nurses, but it can also include all the other sort of people who function as staff within the school system. And so, and the desire and the need to ensure that the services are respectful, that people can understand them, and that they are resonant with their cultural beliefs and practices and language as well. So in the next slide, we want to talk a little bit about how that can be impacted by what is around us. And we talked about culture. Culture is inherent to us. Culture is inherent to the communities we are a part of. And that is an important factor to consider as we think about healthcare in terms of our beliefs, in terms of our practices, and ultimately the health outcomes. Social determinants is another way to look at it, and it really encompasses more the context, the environmental, social, and other contexts that surrounds us as both individuals and as communities. So it's the conditions in which we grow, we are born, we grow, we live, we work, we age. They shape the way money is distributed, how power is distributed, who gets the resources at the local level or the national or the global level. And so that is something that we need to pay attention to. Increasingly, you will find that language, as always, is never static, and there are conversations about the fact that determinant is a very it's a very set term. It doesn't allow for shifts or changes or even resilience, and therefore maybe we need to think not in terms of social determinants of health, but maybe social influences of health, or social factors. And so if you hear that conversation, that's where people are at, but it's the recognition that it's that environmental context is very important.
We'd love to take that one step further, since we have school mental health professionals in the audience, and connect it back to the social determinants of health and education. We know as educators that we can predict or correlate, right? Not causation, income, life expectancy, and future health indicators directly to measurable education indicators. And where the class standards overlap is an indicator point is a tension point of inequity, where you as school mental health professionals or educators can jump in and to help re-navigate or get things back on course for more positive outcomes. We have a couple of resources that will be shared with you after today to dig in with demographic data that's specific to your state. Culture is not something that you can learn and be fluent in. We heard it in talking about the different, Suganya talked about it when she was talking about the trans-like state, that some might say could be a result of something that's unusual, or it could be something that's a strength or a resiliency factor of that culture. So we want you all to start thinking about some of the strengths, solutions, and resiliencies of your community. Reading glasses are to prescription glasses, as mental health care is to culturally and linguistically accessible mental health care. They are both glasses, and they will both help you see better. But one of them is made just for you. They're fitted to your face. They might be bifocals or trifocals, and they will help you see everything more clearly. So not all mental health care is the same, and it's best to have the kind that's made just right, Goldilocks. Thank you so much, everybody. We're really glad that you're here, and we're glad that you're here so that you can get started with us next time. We're going to take a deeper dive into how to crosswalk those class standards and map them onto your school mental health programs and systems. We just needed to take a day to make sure we're all speaking the same language. And then next time, we're going to dig more into those, the flour and the sugar and the frosting and the sauce of what those standards look like in action. And we'll start putting them into use in your school mental health settings in both this next session and session 3 will be our learning lab.